Yeah, this is your station. Time starts.
Yeah, information gathering, patient safety communication, including subject and knowledge, whether ST for gynecology pregnancy with your ST
Tell
one
me
GP
when to stop. Change the slide.
intelligence survey and as reference, we have to see one of them was referred because of excessive hair growth. Okay, next slide, sir. Could you please see Miss Jessie, a 26-year-old city council staff who is complaining of excessive red flags? Close it with red flags. Okay.
Your time starts, doctor.
Hello, I'm Dr. Sugita, one of the doctors in the gynecology clinic. May I confirm your name and age, please?
Doctor, I'm JC, 26 years, doctor.
Can I call you Jessie?
Yeah, doctor, that's fine.
Jessie, I can see from your GP, I can see from your notes that you are here to discuss about your excessive hair growth management options. Am I right?
Yes, doctor, I'm really worried about that, doctor. So can you please tell me what to do with that? And is there a treatment for this?
Well, before diving into the management options for your problem, I would like to first apologize for the absence of my consultant. Is it okay to continue the discussion with me?
Yes, doctor, I really need the help with my problem, doctor. You can go ahead.
All right. So first, I will be asking you a few questions to know more about your concerns. Then I will be formulating a management plan for you. We can come to a mutually agreed shared care plan in the end. And I will also give you some patient information leaflets which you can go through. Is that okay?
Yeah, that's fine, doctor. That's fine.
So can you tell me more in detail about your concerns?
Doctor, actually, maybe around 2, 3 years back, I started getting more and more hairs on my face initially. And later on, even on my tummy and on my thighs, even on the legs, the hairs have started. Initially, I noticed that the hairs were very thin in size, but nowadays they have become thick also. And so I started shaving and all. And what happens, doctor, by any chance, if I don't remove them regularly, it's giving me a very odd look. And as I'm working, I'm interacting with the various peoples in my office, and it's causing a lot of discomfort, doctor.
I'm really sorry that you're going through very difficult time with this issues, but I'm here to help you and support you. Did you try any treatments before?
No, doctor, I just tried, means I'm regularly shaving my hairs and all. That's all, doctor.
Is it associated with any acne?
Yes, doctor. Yes, it is. The acne on my face also, they are irritating, and even there are few acne on my back also. Even I feel my back is little heavy.
And any darkness around your neck, thickness or darkness?
I didn't notice, but I do feel there are some patches or something like that, doctor.
Any tummy pain or a swelling you notice in your tummy?
Not as such, but I'm gaining the weight, doctor. Since last 1 year, I think I must have gained 6 to 7 kg, doctor.
Okay. And is your periods regular?
No, doctor. Actually, initially when I started having my periods, they were regular. But as the last couple of years, I'm getting my periods every 2 months now. Initially, I used to bleed for 4 to 5 days, but now it is reduced to 2 to 3 days only.
And when you get your periods, is the flow heavy?
Initially, when I used to get my periods after 2 months, and they used to be heavy, but nowadays, even if the periods are scanty also, and they are getting after longer duration, doctor.
And did you try any medication for the regularization of your periods?
No, doctor, no.
Pardon me to ask, some of my questions might be intrusive. Please don't mind me asking. Are you sexually active?
Yeah, doctor, I have got partner. We are together since last 3 years, doctor.
And are you using any contraceptives?
No, doctor, we are using the national methods only, and currently we are not planning the pregnancy at this moment, doctor.
Okay. And any sexually transmitted infections in the past?
No, doctor.
How about your smears?
My smears are regular, doctor.
Any allergies?
No.
Any other medical conditions or hormonal problems?
No,
like
no,
thyroid?
no. I have not been investigated up till now, but nothing as of now.
Any concerning histories in the family like clot or any hormone disorders?
No, doctor.
And any other surgeries in the past?
No, doctor. No.
What is your height to weight ratio?
I think it is 28, doctor.
Do you drink or take alcohol? Sorry, drink or
Occasionally on socially on weekends, doctor.
any recreational drugs?
Never, never.
Any how is your support at home?
Yeah, my partner is very much supportive.
How do you feel lately?
Yeah, I'm quite okay. Just this acne and this hair growth is irritating, doctor.
All right. Thanks for all these informations you have shared. Now, coming to your concern, you are now 26 years old and your main issue is the excess hair growth. Let me explain it to you. So, if you can look into this diagram with me, this is your brain and this is your womb, your ovaries, and the tubes. So, usually, the brain sends certain hormones to regulate your hormones, which is released from the ovaries. Okay, these we call it as estrogen and the progesterone, which are the female hormones, which is responsible for your female pattern of hair growth and the moods and all the female behaviors. But however, in some cases there may be some irregularities in this hormone balance, because of which the male hormone or the other hormone called testosterone will be raised in your body, which is secreted more from your ovaries. Am I clear so far?
Yeah, doctor, you mean to say that there is a hormonal imbalance? Is that right?
Exactly. So, because of this testosterone hormone, you may be having some excess hair growth or this acne or other condition called polycystic ovarian syndrome, where there can be some excess weight gain, insulin resistance, or the blackness which you find around your neck is all because of that. And this can cause some long-term implications like diabetes mellitus, or sometimes it can lead to obesity or cardiac problems in long term if it is not treated properly. Am I clear so
Oh,
far?
doctor, yeah, you mean to say it's very dangerous or something like that?
Please do not think that way. I'm sorry if I sounded that way. It is actually, it needs, you need help and it should be treated. Your hormones must be regularized so that you get your periods regularly. If your periods are not regular, if it is delayed more than 3 months, then we need to give you some withdrawal bleeding medications to have your periods regularized. Otherwise, it can lead on to endometrial cancer or the womb cancer in future.
Oh, doctor, I'm really scared, doctor. But
No,
I want the treatment for my hairs, doctor, on my face and all. And is it curable, doctor? Can I get the cure for it, doctor?
definitely cure is available. So let me explain to you the treatment options. You will be cared and the team of doctors, including my consultant, the hormone doctors, the labs, and the blood doctors will all be involved in your care. So there is first thing is the lifestyle modification. The next is the medical management. Coming to the lifestyle modifications, you need to maintain a healthy BMI between 19 to 25. So I can put you in touch with the dietitian and the physiotherapist to cut down few pounds. Cutting down few pounds itself will regularize your hormones and your bleeding will get normalized. Once you get your bleeding every month, the hormones will be regularized. Thereby, the hair growth will also reduce. That is one thing. And coming to the medical options, we do have some local creams called eflanorthen cream, which is nothing but the anti-androgen creams, which will have some burning or stinging sensation when you apply. Apart from that, we have medications like combined oral contraceptive pills, which will also have some anti-hormone effects. It will act against the male hormone, which is raised in your body. So thereby, that will reduce your hair growth. And there is also another medication called anti-androgen group of medications like spironolactone or finasteride kind of medications, which you need to use precautiously. Before using this medication, we will have to rule out your pregnancy, and you have to continuously use effective contraception, because in case you get pregnant, this can have harmful effect on your baby.
Doctor, how much time will it take, doctor, for these medications to act?
Okay, so this will take at least around 6 weeks to see visible effects. So we will be having another appointment after 6 months. 6 months, we will have another appointment to see if it is working for you.
Okay, okay, doctor. And what about any side effects of the medications, doctor?
Side effects of this medication is it can have harmful effect on the baby. Some nausea and vomiting sensation can be there when you're taking the drug, or it can these are some of the known side
Okay,
effects of them.
doctor. Okay, okay. Time is up, doctor. Time is up.
Thank you.
Yeah. So how was it?
This was the station I had this time, sir.
It
They,
was exam station?
yeah, my exam station,
Okay,
November.
okay, okay. See, the overall performance and your approach is good. At certain places, you are little faster, okay, because you want to finish the station and cover the all, what you can say, the all aspects of that. So, that particular fastness, if you can reduce at certain places, because the empathy and rapport with the patient gets deviated because of the speed. That is the thing. Okay. So you need to keep little balance. Okay, here are certain points which I felt and which I want to emphasize first. This station will be borderline for you. Okay, either borderline pass or borderline fail. I'll just tell you why. Because the main thing is that investigations, you completely miss the investigations part.
Yes,
Okay,
yes, yes.
that is the one. Second point, I'll tell you that she told that day to day I'm interacting with the people and it is causing a lot of concerns. So whether she is affecting mental, how is her mental health? Does she require some psychological counseling, counselor support? That is the most important thing. So third thing is that she told that currently we are not planning the pregnancy. You need to take that clue and tell that yes, there are certain medications which are available, which will provide you the contraceptive effect also, and it will work on your this hair growth also. Because this you definitely mentioned that you need to avoid on certain drugs if you are planning the pregnancy, but there is a relation between the two, that what is her plan. So we are making the use of her history, either by asking or whatever information we got, and implication of that in our presentation. That is the most important thing. You have covered that point, that shows that you have the knowledge, but the application of that knowledge pertaining to this scenario is going to be important. You got it?
Yes, sir.
So on these three main points, this task will be borderline task. Okay. So, but your knowledge and the flow was appropriate. You have covered everything. Like now, let us go from the beginning. The introduction, agenda setting, greeting the role player, all that you have covered. Okay. Then this your question was open-ended question. That was good. Uh, Hair growth along with acne. You have correlated those things. Your diagnosis was correct. You have mentioned the explanation with the role player. Now coming to the pathophysiology explanation, it appeared little complicated, but your words were quite okay. Means if you can little improve on that, maybe because of speed, I felt so. Stick to the male hormones and female hormones. At the most, testosterone and estrogen you can talk, but don't make it more complicated. That is what I would suggest. That male hormone is responsible for certain things, and certain female hormones are also increased in the condition what we call it as a polycystic ovarian disease. Generally, it is associated with the weight gain. The management is simple. There and there, you put it out certain things. Okay, the management is also simple, that you need to control on your weight. I'll connect you to the dietitian and some other exercises and all that you need to put there and there, and take it from that, so that you will reduce the time. Okay, so that is the thing. एक 5 मिनट था. So I'll go ahead with the key answer key. Okay, let's see. But these were the main highlights which I noted. Okay.
And when
Yeah.
she asked if I will get if is it a cancer? I touched that endometrial cancer, but this androgen secreting tumors also I should have told her.
Another thing, here the expectation was that you will cover her, take care of her emotions. Basically, she's distressed because of that, her day to day, and we are going towards an opposite end, like the talking about more of the complications and all. You got it? That you need to touch upon these complications, and you need to take care of the medical management, explain the pathophysiology. That's all. Okay. Now, detailed information gathering, detailed history of hirsutism, associated symptoms, acne, weight gain, acanthosis nigricans, irregular periods, family history. You did ask exclusive factors, drugs or other medical problems, investigations, follicular phase and ultrasound scan of the ovaries, and this you should not miss. Okay. Explains the need for examination, including quantification of hirsutism, Ferriman Galloway score. Okay. Now coming to the communication with the patients, introduces and yourself and explains the possible diagnosis. PCOS but differential will include iatrogenic, familiar and adrenal tumors. Discusses investigations, biochemistry, FSH, LH, testosterone, sex binding hormone globulin and prolactin, an ultrasound scan of the pelvis, ovaries and abdomen for adrenals. Explains the treatment options like mechanical shaving, creams, laser and electrolysis. Hormonal combined hormonal contraception and anti-androgen, sapropterin, acetate and others. Implications for periods, fertility and long-term health, showing sensitivity in discussing this. See, here you have covered this particular part quite well. The other options here you did not cover much. You did mention about the cream and combined hormonal contraceptives. Okay, but there are other options which are cosmetic in nature. They are also available. So reference to the dermatology or skin specialist is also you need to mention. Okay, hormonal investigation, the battery of investigations we need to carry out, because there is a hormonal imbalance. Certain hormones which are coming from the brain, that also we need to test. Okay, so this is the way you should be presenting. Now, communication with the colleagues, you will liaise with the endocrinologist, referral to the reproductive medicine, involvement of the clinical psychologist. This is important. Poor self-esteem, especially with weight. These patients definitely have this on the back of mind, certain things. So never forget clinical psychologist referral. Okay. Links with sleep team to discuss sleep apnea, connects the patient to patient support group. Okay. So that is the communication with the patient. Then patient safety, confirms patient details at the start of the task, empowers the patient to make informed choices, safe prescription bearing in mind the weight, counsels about the long-term medical implications of pathology, ensures allergy is ruled out, and counsels on medication and pregnancy, including the risk of medication. Okay, so these were the points of patient safety. Now, discuss the diagnosis of PCOS with differentials. Here you have covered PCOS quite well. Then treatment options, focus on hirsutism, mechanical bleaching, shaving, depilatory waxing, laser and drugs, hormones, COCP, anti-androgen. Discussion on weight control and lifestyle modification. That also you have mentioned. Lifestyle modification is the first treatment for this. Implications for fertility, that you need to emphasize a little, because she's young, 26 year, and you need to correlate these two issues. Okay. Familiarity with current guidelines, ISHRI and international consensus, that if you can put it in any, even if you have got a SD, or even if you have got any other task, and if it comes to the guideline, that in some or the other way, if you come bring that guideline into the picture in the discussion, that is better. Especially in structured discussion, you should, the nice guideline mentions this particular thing, you make that particular thing in your discussion. Okay, so that is the thing about this particular task. Overall your approach is good. Okay, but don't miss on, like here the investigation
So
part
when
was
she
missed.
asked about side effect of the medication, I should have told about the COC side effects also. Then anti-androgens, the
Yeah,
strategic.
basically here it was expected that please do not miss these pills. These are hormonal pills. You take them regularly. Nausea and vomiting is the commonest. It can cause gastritis. You can have acidity if required. We can add some medicines for that. Okay, but how to take these medications, that was actually, it was expected. Okay. And the duration you need to mention 6 months is appropriate time that you have mentioned. It takes around 3 to 6 months to have the effect. Okay.